It's that time of year. Have you looked at your options to make sure you're in the right plan for the coming year? Why is it important to have an accurate picture? To get where you're going, you need two accurate pictures. Number one, where you're at. Number two, where you're going. Otherwise, you won't be able to find your way. The probability of you not getting there is risk. I covered this in my series, The Three Choices That'll Make You Rich or Poor. This video details one risk that you have in particular for this time of year, which is healthcare. Why does 10% of the people have 80% of the wealth and 1% control most of that? What happened to the other 99%? The majority are answering the wrong question. The industry asks, how do I get people to buy what I sell? The customers are asking, how do I complete my shopping list at the lowest price? Here's a better way. You have some degree of wealth. Risk is what will take that away. So the question to ask is, how do I use fewer pennies to keep from losing my dollars while growing to more dollars? The correct industry question is, how do I provide that choice that solves their problem using the fewest pennies to save their dollars while building more dollars? Are you ready for what's coming? We're in troubling times. We're in the largest budget deficit in U.S. history. Unrest, riots, burning cities and them going bankrupt, socialism on the rise, major banks failing, millions behind in rent, thousands of small businesses are gone, COVID-19, defunding police, churches forced to be closed, and a possible depression ahead. But don't panic, you just need to prepare. Whether good or bad times are ahead, keeping as much of your dollars as possible is a priority. Healthcare is a big part of that. This video helps simply choosing a plan that answers that right question. How do I keep more of my dollars? What does AEP, annual election period, mean, and how does it affect me? The annual election period, AEP, or annual coordinated election period, is when Medicare beneficiaries can add, change, or drop their Part D or Medicare Advantage plan coverage for the next year, an 8-week period from October 15th to December 7th. These are the different parts of your Medicare benefit. There's Part A, which is the inpatient hospital, Part B, which is outpatient and inpatient mental health, Part C, which is the Medicare Advantage, and Part D, which is standalone prescription drug coverage. Medicare benefit Part A. Part A is the hospital insurance coverage portion. You usually don't pay a monthly premium for Part A, the hospital insurance coverage, if you or your spouse pay Medicare taxes for a certain amount of time while working. In general, Part A covers inpatient hospital, skilled nursing care, nursing home, hospice care, and home health care. Part A premium. Again, most people don't pay a monthly premium for Part A, sometimes called a premium-free Part A. If you pay Medicare taxes for less than 30 quarters, the standard Part A premium is $458. If you paid Medicare taxes for 30 to 39 quarters, the premium is $252. 40 quarters and beyond, you don't pay a premium for Part A. Part A hospital inpatient deductible and coinsurance is $1,408 in deductible, and the benefit period is day 1 through 60. And again, starting day 61, if you haven't been hospitalized, again, it resets. Day 1 through 60, there's a zero coinsurance for that benefit period. But starting at day 61 through day 90, you're paying $352 per day in coinsurance. Day 91, if you had, again, an extended stay, starting day 91, you're paying $704 per day for those stays in the hospital. Beyond lifetime reserve days, you pay all the cost. Now, Part B. Part B covers two types of services, mostly outpatient care. Medically necessary services or supplies as needed to diagnose or treat medical conditions. There covers preventative care, health care to prevent illnesses like flu, detect illnesses in the early stages when treatment is most likely to work best. Part B also covers things like mental health, in and outpatient, and partial stays, clinical research, durable medical equipment, ambulance, and limited outpatient prescription drugs. This slide shows your Part B premium, and it's based on your tax return. And you look at the different brackets here, individually, jointly, married, and filing separately. But the bracket, $87,000 and below for an individual, starts at $144.60. It goes again, the next bracket, $202.40. After that, $289.20, $376 after that, $462 all the way up to $491.60 at the highest bracket, $500,000 and above. Now these are the 2020 figures. We don't have the release for 2021, but again, it's based on how you have filed your taxes. The standard Part B premium, as I mentioned in the prior slide, is $146.60 for 2020. We're expected to go up to $148.50 as of 2021, but we don't have the release yet. And the deductible is at $198 for Part B, but again, we do not have the release of where the deductible is going for 2021. Medicare Part C, which is Medicare Advantage or MA, these are all-in-one plans. They're an alternative to original Medicare. They're offered through private insurance companies approved by Medicare. And if you join a Medicare Advantage plan, you still have Medicare. These plans are bundled with Part A, which is your hospital benefit, Part B, your outpatient medical, and usually a Medicare prescription drug card or Part D. Under these plans, Medicare no longer pays on your claims, but the insurance company. You pay out of pocket to receive services based on your plan benefits. You must continue to have Part A and Part B and pay those premiums for Part B. Plans most often have an in and out of network maximum out of pocket, and your benefits and costs can change yearly even if you keep the same plan. The benefits of having a Medicare Advantage plan: they can have a lower premium than a Medicare supplement. They can have extra benefits like dental, vision, hearing, gym benefits, etc. They can have a lower total out of pocket than a supplement if you use it less. It gives you versatility to review your health care every year and make changes. Some of the plans return a part of your Part B premium. It's easier to get a Medicare Advantage plan than it does a supplement if you have pre-existing conditions, certain pre-existing conditions. Plans provide incentives for quality care and care management of conditions. There are many options to choose from, and plans are rated so that you can have an idea of how good they perform. Now, the possible drawbacks of Medicare Advantage or Part C. They're more difficult to compare the different plans every year when you're shopping for the plans, because each plan has different benefits. It's harder to compare to a supplement because you don't know what your usage rates are going to be. The out-of-pocket expenses can be higher than a supplement if you use it more, especially on multiple or extended hospital stays or both. An average in 2021 as far as in-network out-of-pocket is $7,000 and out-of-network $11,300. Most plans have a network, possibly a higher expense. Doctors can come on and off that. You have restricted ability to change outside the enrollment periods. Many combine medical and prescription drugs, and you may not like those equally. You may like one benefit and not like the other, or not be satisfied with the other. It's harder to budget if you could have a good year and you could have a bad year based on how you've used it. You may not be able to go back to a supplement based on your health conditions. So there's a drawback there. You could have to only this is your choice if your health changes. There's less versatility to use it if you travel outside the normal service area. Now, Medicare supplements. A Medigap policy or Medicare supplement is a health insurance sold by a private insurance company to fill in the gaps in original Medicare. The Medigap policies help pay some of the healthcare costs that original Medicare does not cover. If you are in original Medicare and have a Medigap policy, then Medicare and your Medigap will each pay their share of the healthcare cost. You must have Part A and B and pay your Part B premium. The standardized Medigap policies must provide the same benefit. The only difference between the Medigap policy with each insurance company is the premium, as long as you're in the same type of Medigap. Many are guaranteed renewable, which means your coverage stays the same every year. The only thing that can change is your rate, and as long as you pay those premiums, you're guaranteed coverage from that point on, as long as you pay your premiums. Medicare supplements continue. Medicare pays first, and then your supplement pays the balance of the authorized amount based on your plan benefits, including your Part A coinsurance, hospital cost up to an additional 365 days, Part B coinsurance, copayment, blood, the first 3 pints, Part A hospice care and coinsurance and copayment, skilled nursing care facility, coinsurance, Part A deductible, Part B deductible, Part B excess charges, foreign travel, emergency care up to the plan limits. Now, these are the 3 most popular plans, Plan F, G, and N. Now, this is what you pay. The rest is paid by the plan. Under Plan F, you pay nothing. Once Medicare has paid their approved amount, you owe nothing more. Plan G is a little lower premium, but the difference is you have to come up with Part B. So that's the only difference in F is with Plan G, you got to come up with a Part B deductible. Plan N is a little lower rate than that, but you have to come up with a Part B deductible, Part B excess charges if there are any, then $20 copayment per office visit, $50 copayment per ER. And again, all these plans you pay the 20% for foreign travel emergency care up to the plan limits. Next, the upside or the good side of Medicare supplements. Plans are easy to understand and compare because they're standardized. Low limited out-of-pocket expense, so you have a very stable healthcare cost once you pay your premiums. Once you have a major claim, it's encouraging to be left with little or nothing to pay. You keep the same health care benefits every year, so there's less to have to deal with every year. Much easier to budget without health care surprises, because again, once you make your premiums, you have little to pay after that. They can seem a richer coverage because of the low out-of-pocket. So you might have a greater likelihood of receiving care or going to receive care because you don't have to worry about your out-of-pocket. Less need to factor, which is the next point, less need to factor in the cost when you consider your care. You can go to any doctor who accepts Medicare, so there's no out-of-network or worries about provider acceptance. There's no plan managing how you get your care. Plans are far less chance of you having a bad year or having to pay off medical bills, unlike a Medicare Advantage plan, because there's very little out of pocket once Medicare has paid their part and your supplement has paid the balance based on the plan you chose. The benefits don't change every year, so health changes don't. You don't have to add your changes in health as a worry when you're shopping your coverage because your benefits stay the same. It's easy to shop because, again, plans are standardized. So if you're looking at an F plan, and you're comparing companies, they're going to be exactly the same as long as you're looking at that Plan F with that other company. The only difference is going to be the rate and the insurance company. Same thing with the G or the N. As long as you're comparing like plans, the only difference is going to be the rate with that other insurance company. The drawbacks of a Medicare supplement. Premium rates are typically higher than a Medicare Advantage. If you're not using it enough, it may seem like those are wasted premium dollars versus a Medicare Advantage because you may not be able to see that you're getting that extra value out for those premium dollars you're spending. has no drug coverage, so you have to add a standalone drug card, which can add additional premium. What is Part D? Medicare prescription drug coverage is an optional benefit offered to everyone who has Medicare. If you don't take prescription drug coverage when you're first eligible, you're likely to pay a late enrollment penalty if you join it later, unless one of the following applies: if you have credible prescription drug coverage or you get extra help. 2 ways to get Medicare prescription drug coverage. Medicare Prescription Drug Plan, Part D. These plans, sometimes called PDPs, add drug coverage to original Medicare, some Medicare cost plans, some Medicare private fee-for-service plans, Medicare medical savings plans or MSAs, and Medicare supplements. Medicare Advantage Plan Part C, like an HMO or PPO, or other Medicare health plans that offer Medicare prescription drug coverage within their plan. So simply, you can either get it in a standalone drug card or within your healthcare plan. Cost of a Medicare prescription drug coverage: premium, yearly deductible, copayments and coinsurance, cost in the coverage gap, cost if you get extra help, cost if you pay a late enrollment penalty fee. Your actual drug plan cost may vary depending upon the drugs you use, the plan you choose, whether you go to a pharmacy that's in network, whether the drugs you use are on the formulary of your plan, or whether you get extra help in paying your Part D cost. Things to consider about Part D. It's important to have someone use a drug search tool that factors in all the pertinent details that can affect your cost and usage: the name of the medications, the dosage in milligrams, etc., how often you're taking it, the name of the pharmacy, the county you live in, and whether it's brand or generic taken. It's important to take this directly off your prescription bottle because small variations can make a big difference in your projected cost. These tools show exact monthly and annual cost, restrictions, and limitations. You can see the different plan options with each company, showing actual costs so you can make an accurate decision. You can keep these for future reference for why you chose the plan you did. Maintenance medications are one of the few costs that you can predict, so you should weigh these options heavily in your decision for healthcare options. How to simplify the process of finding the right plan. Number one, you got to make sure that you have the details of all the plans that are available in your area. Make sure that you account for your current and future healthcare needs. Make sure that your medications that you'll be taking are covered and what those costs are going to be. Make sure that your doctors you want to see are in network if that's according to the type plan you're choosing. Make sure the same thing, hospitals, labs, testing centers are in network based on the type plan you're choosing. Make a healthcare case study with 3 scenarios: low, moderate, and worst case, based on your usage, how much you're going to be out of pocket between your premium and your out of pocket expense. Make sure that you use the exact same examples on each plan so you're comparing equally the plans. Make sure that all medications are broken down by plans, separating it from the medical. So you have the medical and your drugs accounted for. You see both sides of it. Make sure that you factor in any possible help that you can qualify for. Make sure that you eliminate the plans that you wouldn't select, whether it's a network issue that your doctor's not in it or doesn't accept it, or that your health care or your prescription drug costs in a particular plan are too high. Whatever reason that is that you wouldn't choose that plan, eliminate it from your case study. Make sure that you put a simple printout of the results so you compare for your decision and also for reference for the future of why you chose that particular plan. Once you have found the right plan, go back and review all the plan details thoroughly to make sure that that is the right choice that you want to make. How I construct your case study for each plan. I use the exact same inputs for every plan that's available to you in your county. I split it into 2, a medical case study and a prescription case study. On the medical case study, I use 3 different scenarios: a low, moderate, and a worst case. On the low, I use 4 doctor visits, 2 primary, 2 specialists,
2 lab visits, 1 ER visit or emergency room visit, 1 outpatient test. On the moderate, 6 visits to the doctor, 3 primary, 3 specialists, 3 lab visits, 2 emergency room visits, 2 outpatient tests, and 1 hospital stay for 3 days. The worst case, I use each plan's maximum out-of-pocket in and out of network. Then over to the prescription case study, I input all your medications, the name of the medication, the dosage in milligrams, how often you're taking it, whether it's multiple times a day, daily, or weekly. Record brand or generic right off the bottle and the name of the pharmacy. I run the monthly and the annually for each of these. Again, using the same inputs for every plan that's available to you. This will give you an idea of what you would have out of pocket under each of these scenarios for each plan, so you have something to judge how to compare the plans. How I show the results of your case study. Again, from the prior, we use the same inputs for each plan. How we present those is the plan premium plus the medical out-of-pocket plus the prescription. So you have a total under the low, medium, worst case. So the results you can see if under each situation you run under that plan which you've been out of pocket, so you have something to compare each plan equally. Simplifying the process, the conclusion. You have a very important tool in this process. I've been doing this 25 years, and the cost to you is absolutely nothing to help you to evaluate your options, to get a clear picture of the right plan for you. That's what I do for you. I talked in the beginning of this video about my series of 3 choices that'll make you rich or poor, and those choices relate to risk. Risk is what takes you wealth, leaving you poorer. What we have been talking about this entire video is one of those risks, which is healthcare costs. Making the right choices can make the difference between being rich and poor. This is one of many that you will make. I help you find the answers to make the right one. The next step is to let you know what will need to be able to proceed. Please prepare the following information so I can get to work for you. Number 1, list all your medications, the dosage, the milligrams, how often you're taking it, the name of the pharmacy, name of your doctors and hospitals and any other locations, and of course their locations. Medicare cards, current plan cards, ID with your address to verify your address for the plan. You don't have to supply these, but just have them ready to reference. Names of any emergency contacts that you would like to be able to discuss your benefits or to help you. Details of any special needs or services that are important for you to receive. And a list of what your likes and dislikes about your current plan so that we can target the likes and avoid the dislikes. I can't help what I don't know, so you need to, if you need help, whatever you need help on, let me know. What am I required to get from you before I can release the plan results to you is what we call a scope of appointment form. It's a confirmation form and I'll read this to you. The Centers for Medicare and Medicaid Services requires agents to document the scope of marketing appointment prior to face-to-face appointments, meeting to ensure your understanding of what will be discussed by the agent and the Medicare beneficiary. All information provided on this form is confidential and should be completed between the Medicare beneficiary and the representative. The person who will discuss these products is neither employed or contracted by Medicare. They do not work directly for the federal government, and the individual may be paid based on the enrollment in the plan. Again, doesn't come out of your pocket, but yes, we are paid by the plans. And this scope of appointment form can be done by paper, electronic, or telephonic, and I will discuss which plan, which option will be best for you. But again, that scope of appointment is a Medicare requirement for us to get before we release the plan details to you. I want to thank you for your time. Hopefully it's been time well spent. You have my contact information here. You probably received an email from me with this video and the links to my other videos and the 3 choices that'll make you rich or poor. I advise you to take one step at a time. This is a marathon, not a sprint. This is time of year to take care of your health care options, and hopefully this will help out in the process of making that choice, simplifying it, and I look forward to helping you along in this process and answering any questions you have.